The state health department is urging people who attended the Hawaii's finest music event at the Bishop Museum last weekend now to get tested. More than 3 positive cases have been detected among those who attended the event, and that's now been added to the state's cluster report. The state sees, meanwhile, another quadruple-digit increase in COVID cases today, with 1,384 new cases reported. There were no new COVID-related deaths, and the state's vaccination rate now stands at 73.9%. And as the COVID cases continue to rise, the CDC issues new guidelines shortening the quarantine and isolation periods for those with COVID or those who have maybe been exposed to the virus. Nikki Schenfeld has more.
Governor Ige and the state health department say they are reviewing the recommendation, but for now, the quarantine and isolation period remains at 10 days for people in Hawaii. But it comes as hospitals are putting up tents once again outside of their emergency departments in preparation for a potential surge. The latest recommendation would reduce the quarantine and isolation period from 10 days to 5 days if you test positive but are asymptomatic. When it comes to those who are close contacts exposed to COVID, the unvaccinated and non-boosted would be advised to quarantine for 5 days, and people with boosters would not have to quarantine.
While the guidance comes out, it's not a mandate, and so we are looking at this very, very carefully.
He says health officials are meeting tomorrow to discuss last week's CDC recommendation on giving healthcare workers a shortened quarantine period to help reduce staffing shortages.
We do have a few hundred, actually more than a few hundred individuals who are out right now across the state. And as the infection rate continues to increase and the positivity rate continues to increase, that means it's going to impact more of our healthcare workers as well.
And hospital beds, too. He said there are 100 COVID patients hospitalized, almost double since last week.
Things could get very tight between the number of staff who are out and because they've been exposed or tested positive and because of the potential surge.
He said reducing the quarantine would bring staff back sooner, but wants to protect patients at the same time. He said other hospitals have requested to bring tents back to help make room for COVID-positive patients.
We're hoping it blows through fairly quickly. The question, though, is how much damage is it going to inflict before it blows through? And it's going to create, unfortunately, quite a bit of damage in this state.
Queen says the tent will be up and running, hopefully, towards the end of the week, and will provide better separation between COVID and non-COVID patients. Nikki Schenfeld, KHON2 News, working for Hawaii.